Always fresh and a little bit sticky. Keep it locked on Cannabis Wiki. We're always fresh and a little bit sticky. The green room on Cannabis Wiki.
Hey everybody, welcome to the Green Room live from the Cannabis Wiki Conference and Expo in beautiful London, Ontario, 2023, day 2, year 2. Yay, that's an accomplishment, man. We did this, D.
Yes, Jackie.
Yes, we did. And now we're joined with Andy Donald from the Home Depot.
Health Depot.
Whoa.
It's not the first time I've heard that before. You're not the first and you won't be the
Andy
last.
I got your name right. I got your name right this time. I got Andy Donald down from the Health Depot.
You got it. You
Yes.
got
We've
it.
got Andy Donald from the Health Depot joining us on the Green Room Live.
Good to be here, guys.
Thanks for being here. What is the Health Depot?
So we're what we call a clinical pharmacy. It's kind of unique. A lot of people don't know what that means. Which means we help to personalize your meds and doses based on your body and your side effects and everything, because we have access to e-health. So it's interesting that we're now a part of Green Shield, which is a big insurance company. A lot of people don't know that they are a not-for-profit insurance company. And so we're technically, I guess you could say, a not-for-profit
There's such
pharmacy.
a thing as a not-for-profit
Yeah.
insurance company.
Yes, there's actually a couple,
Wow.
but they're the biggest one.
Okay.
Canada-wide. And so now we do all pharmacy-related things, delivered to you, home or cottage, wherever you are, for free, right across Canada. But our specialty is that we tap into e-health, and we can see your kidney function. We know with your liver function. We talk together with your doctor, because a lot of people don't know that. I grew up in a big doctor family. That a lot of doctors and surgeons in my family. That doctors, when they go to school for 4 years, they focus on, doing what we need most in healthcare, is diagnosing you from 10,000 conditions, and also learning healthcare procedures. They learn very little about the medications. That's what pharmacists do. We learn the opposite. But yet for a long time, up until recently, the whole healthcare system has been so siloed that doctors have been forced to diagnose you, but then pick what drug to give you, and then monitor the safety of the drugs that they learned very little about in school in the first place. They learn from drug reps. So now with e-health and everything like that, we now, once we have the diagnosis from the doctor, we can help to personalize the dose, switch her to safer alternatives. Because we have a big medication overuse problem in our country. That
Yes, we do.
it's really bad. That 2/3 of seniors over the age of 65 are taking 5 or more meds, a quarter are taking 10 or more, and 1 in 12 are taking 15 or more medications.
Oh, no.
And also they're taking the wrong types of meds. There's meds that over the age of 65 you shouldn't be taking because they get more likely to land you in hospital. They're called Beersless, unsafe medications, and about 31% of seniors take one of those drugs every single day.
Well,
That
why
account for
does the
30.
doctor prescribe that drug?
It's lack of knowledge. It's like the same kind of thing. If I was, when I get out of pharmacy school, and if they were to ask me to go out and diagnose every one of my patients, I'm like, I didn't go to school for that. Right? It's what meds are safe, but as we get older, certain meds can accumulate more and cause more problems. And it's just not having the time and that knowledge to know what are the problematic ones. So that's what we kind of specialize in. We help to personalize and get you off the unsafe ones on better alternatives, because there's thousands of drugs out there.
Right.
What works for you doesn't necessarily work for me. And that's why less than 50% of Canadians are actually compliant with their medication, meaning that they don't take it at the dose and they don't
Or the
take their
time.
meds because it doesn't make them feel good.
Right.
Right? We need to personalize that, and that'll get better health for the individual. So that's kind of in a nutshell what we do. We have an online store for over-the-counters that we ship across Canada, like kind of a la Amazon. We do everything, and we're in the Green Shield environment, but there's a lot of drug interactions and concerns about meds, and that's what we specialize in personalizing. And that's also why we're here today, because there's a lot that ties in with cannabis use, believe it or not.
Art,
Yeah.
you go ahead, Derek.
Well, what I was going to say is that's very interesting. So, like, you kind of take the doctor is prescribing, or they're diagnosing an issue, but then what they prescribe might not be exactly the best for that person. It's more of a general prescription, and then you come in and customize that to the person. That sounds really good.
Yeah, and I myself am a certified geriatric pharmacist, and something that goes missed all the time is that often the drug studies, believe it or not, are done in 20 to 30-year-olds, right?
Oh,
they do
my
the drug study in
goodness.
20 to 30-year-olds at the
For
kidney
65
function and the liver function of a 20 to 30-year-old, and then they find the ideal dose for that, and then the doctor's like, I'm going to give that to this 85-year-old.
Oh my goodness.
So what happens is as we grow older, our kidney function goes down every year of our life, and our liver function goes down a little bit less, but that causes medications to stick around significantly more and more every year. But then what happens, you see often in the communities, because lack of knowledge about drugs, the patient will stay on the same dose for 30, 40 years. But what that's really doing, it's increasing and causing more and more problems. And then what happens is the side effect of one drug is treated with another drug, is treated with another drug, and it kind of snowballs.
Right.
So what should be happening is as we age, your doses should be coming down as your body slows down, and then switching to safer alternatives over the time. But that's not happening. So that's kind of what we kind of specialize in. So just making sure it's the right med and the right dose for you. And we work together with your doctors, and they love it because you give them proof. It's like, so-and-so shouldn't be at this dose. We want to lower it from this dose to this dose because their kidney function is this. And we give them an actual number, what their kidney function is. And this is becoming high and toxic. Doctor sends back, oh my God, that's amazing. Please, yes.
So let me ask you this. So if I want to become a customer of Health Depot, then do I do some tests for you to get a baseline of me? Like how do you, do you look at the charge from the doctor already doing that?
This is what's the game changing, because that would have been a lot more tough for individuals. But we have access to any blood work you've done. If you're a patient of ours, it's implied consent.
Yep.
We have access to any blood work you've had done in the hospital or in the community at Dynacare, Life Labs, anything like that. So we can just see that ourselves. And anytime you get any kind of blood work, they do your kidney function test. People don't realize it's called creatinine clearance. So we see that too. And there's lots of those things in those tests. And, even my dad, being a 73-year-old, still full-time physician, he'd say, why do you need to look at blood work? I look at blood work, right? And he's like, but I said, well, when you look at blood work, what do you look at? He's looking, and I gave him a whole bunch of examples. He's looking to diagnose you based on your blood work. Whereas when I gave him those examples, it kind of loaded, of course. I was like, it's really the blood work told you what was wrong with your meds and what you need to do. Your body's doing to your meds and your meds are doing to your body. So we look at it in a different aspect because that's our expertise.
Right.
As people jokingly called me when I used to be more in retail and I used to be an owner of a big retail chain before starting the Health Depot. Some of my patients used to call me Dr. Pill. That's a joke. And like Dr. Phil, but it was like more like because they said, my doctor diagnoses my condition, you diagnose my medication. I'm like, yeah, well, that's like what kind of they're doing, right?
Pill.
Yeah. So that's kind of being pill doctors is like the future of what clinical pharmacy needs to be. And in our healthcare system, as we have this new e-health and AI and all that stuff coming, it's going to be doctors who 20 to 30% of Ontarians don't even have a family doctor anymore.
Right.
I
They're
know
very
one.
underserviced. You
He
don't
died.
have. Yeah. And then there's no one there wanting to take up the mantle,
Slack.
right?
They put me at a clinic at the hospital, and then they'll every 3 months they'll I'll have an appointment there to follow up, but they don't I don't have a doctor.
You got a new doctor, a new nurse practitioner every single time too, so there's no
Right.
continuity of care. But then the future is going to be that doctors diagnose you, and once you have diabetes or heart disease, right, you have that, and unfortunately until the day you die, that's a chronic condition. From then on, your main point of contact will be your pharmacist. Because then we can adjust the doses and adjust your meds as your blood pressure, your blood sugars, all that kind of change, because we have access to that information and we know how to tweak you. But more importantly, how you feel, right? How many times I've heard from seniors that, they're dizzy all the time and they don't realize that that's not a normal process of aging. That's that you're on too high a dose of a medication or too many meds. And it just blows their mind. So that's why at the Health Depot, we have a lot of combination. We're the preferred pharmacy of CARP for all of Canada, Canadian Association of
Right.
Retired People. We're the preferred one for Alzheimer's Society of Ontario,
Wow.
Parkinson's Society, a lot of different organizations that we're really trying to help to personalize meds and improve conditions. And that's kind of why, pharmacists are not involved with cannabis right now because it was a big miss in our industry that when they came to, when Trudeau, I guess, was really eager to legalize it in a hurry, because I think he was a little bit of a rec user himself back in the day. He's like, legalize it for everybody, right? And which is good because there's a lot of health benefits from it. But when they came to the leaders in pharmacy, they asked them, "Do you want this?" And it was in a rush deal, and they said, "Well, no." Because and it's unfortunate because the people at the top didn't understand the health implications that it could do. I think they were more concerned that the stigma that, we just got rid of cigarettes out of pharmacies like a decade ago.
Right.
We're not going to bring smoking cannabis into, but they didn't really think of the oils and the health impacts that cannabis can help with, right?
Right.
So medical cannabis needing to be through pharmacy, and that's a big miss, because here's something a lot of people don't know, and this is why doctors who don't know medications well are refusing to allow their patients who are complicated on a lot of different meds take cannabis. It's one of the worst drug interaction drugs out there. So what that means is, if a lot of seniors, they may, you're not allowed to have grapefruit juice if you're on certain medications, right? Getting a little nerdy here, and I apologize. The main enzyme in your liver, that's where you chop up all your drugs. It's called 3A4, and that's like one that about half the drugs are broken up by. Well, grapefruit juice is a chemical in it that slows down your liver, which means your drugs stick around longer.
Right.
Well, cannabis, both CBD and THC, they slow down not just that enzyme 3A4, but 2D6, 2C9, 2C19, tons of different ones that most of your drugs need to be adjusted. And so when patients have side effects, and so doctors are scared, not knowing the drugs as well and what to do, what is it going to do to your heart medications? It's going to skip your heart out if it's too high. Your seizure meds, if they cause those meds to increase. And at all these conferences, the secret's out that medical cannabis can help out with so many different conditions, especially in seniors, the big trifecta I call pain, sleep, and mental health, right? And mood. It can help with all those, but doctors don't want the patients to take it because they're scared of what it's going to do to their other meds. They'd rather them, for pain, take even, like, say, a narcotic, which is 10 times worse for that patient, but they know way worse, but they know that it's not going to throw off all their other meds. So the big miss is pharmacy's not involved, especially clinical pharmacy, because it's just like warfarin, and other meds that, once you go on that, sometimes you have to adjust the other meds. Well, if you're going to go on cannabis, CBD therapy as well, that we just might need to take you down on some doses, lower the dose of certain meds, or switch you to better alternatives, and then you can keep your therapy. And then here's the thing too. Since cannabis slows down your liver, any future drug you take, including antibiotics, has to come with the lens of what dose and what CBD you're on, and how much it's going to slow down and affect that other medication you're going to start. So it's like a continued thing. So that's why you see here at this conference here, there's not much representation for medical cannabis because they've seen that it's gone a lot more recreational. But I mean, it really needs, the medical side needs to almost differentiate and separate from the recreational. And that if you're on medications, the message has to be, you really need to go to a pharmacy and they can help you out, because people's intolerances, a lot of seniors said they've tried on their own medical cannabis and they felt god awful. And like just CBD, and they said, I felt terrible. The room was spinning. I almost wanted to vomit and all that kind of stuff.
This.
You've heard this.
Yeah.
But that's not the cannabis. And they think it's the cannabis. What that's doing is it's slowing down their liver. So now the side effects of all their other drugs are causing those side effects. So if they would have lowered those other drugs, they might have been okay.
So is what you're saying that if you are on medication, you should be careful of what cannabis you're choosing?
Well, it's not just unfortunately, I mentioned like THC and CBD both slow down your liver, right? It's significantly, so it's almost anything. And even you like an edible,
a tincture, flower, smoking,
and the more you
what's
take
the worst,
it, the
I
more.
wonder.
Yeah, and it's so, and that's where there has to be a lot more research. But the important point is, pharmacy needs to be involved to see this. We need to standardize also doses, so we know the effects on the other meds. So I think you were listening to when I was on the stage yesterday talking about this. How medical cannabis comes up. We need to, in order for coverage, we had some talks about some ODSP patients that are disability that are frustrated because cannabis has helped them out medically so much, but they can't get it covered.
Right.
And the reason why the government won't cover it is because it's willy-nilly free. Everything goes. There's not a set standard and a set formulary and of proving doses that they could then, maybe get a DIN that the government would then cover. And that's huge because it has huge health impacts that it can help. But we need to, there has to be more framework and standardization, and including pharmacy in order
Right.
to make it happen.
What is the fee to access this?
Yeah,
access
good question,
you.
Jackie.
Like, there's got to be a fee or some sort of process to access your knowledge.
Well, it's like our clinical team. We do this stuff right now, believe it or not. That's why I chose to be a part of Green Shield instead of a for-profit company, because unfortunately the government doesn't even pay us for a lot of the stuff. So
Wow.
we donate this. This is kind of our, so when patients come to our pharmacy and fill their stuff, all the profits we go back into making sure it's the right drug for you. Because there's a few things in Ontario you can do, like a meds check or something like that.
Right.
And you get a little bit of money. But the amount of deep diving and working together with your doctor we're doing, you don't get paid for that. It's almost, I'm doing that to try to prove its importance to then get more billables for pharmacy to move our profession away from, you might see most pharmacies nowadays, I call them conveyor belt pharmacies.
Conveyor belt pharmacies.
So what, like almost like assembly line, because pharmacies right now primarily get paid for every medication they put out the door. Red pill, blue pill, white pill, red pill, blue pill, white pill. Like, I call it blindfolded pharmacy. It's like,
Yeah.
we're just saying, yeah, the doctor said blue pill, I gave you a blue pill. Not is it the right blue pill? Should it be a red pill? So we're not.
Let me
being
ask you a
paid for that.
question. Let me ask you a question.
So we do it for
Because I
free.
have a pet peeve about pharmacies, and it's not the Health Depot, to be clear. It's okay. I had an ailment, and I had to go to the hospital, and they gave me medication. And so when you go, and this is specifically Shoppers Drug Mart. So like I go there, and like I'm like, okay, here, Phil. Here's my prescription. I need it. When do you need it? Well, I'm here. Like, I'd like it now. I'd like it not to go home and come back.
That would be good.
That would be good. Okay. So then it's like they take it, and then it's like they're doing something. And I know there's got to be some kind of rules or regulations, but I don't know what the hell they're doing. But come on, they have the bottle there. This should take no longer than 10, 15 minutes. But somehow they make it a 45-minute process, like as if, like, and I don't know. I'm glad we have a pharmacist here because I want to know what happens. Like, do they have to count the pills? Then there's like a cooling off period or something. Then you have to recheck it. You know what I mean? Like, what is the regulations? Because it's ridiculous. And it's like, the guy, I feel like he's like looking at me like, okay, like, like he's taking his time, like,
This
just to
is,
see how much he can irk me.
Yeah,
Like,
absolutely. Like, this is Jerry Seinfeld did not help us with this. I don't know if you've seen the sketch. It's like, what do pharmacists do?
Right.
They're up on high. They take pills from a big bottle and they put it in a small bottle.
Right.
It's like, but it's like, there's a lot more to it. So, I mean, like, right in the more retail that they're just trying to get prescriptions out the door, even for that, but they need to input it, make sure all the right information's there. Then the pharmacist has to do a therapeutic check. They're supposed to make sure it doesn't interact with all your other meds, right? They're supposed to do that. And then it has to be filled, and then it has to be checked by the pharmacist. And obviously there's stuff going on. Like there's lots of other scripts they're doing at the same time. They're fielding phone calls, and now pharmacists, they're in the other room doing an injection. They're doing med checks. They're constantly being pulled away. So usually it's the slowdown is the pharmacist, the final, that they're just running around doing too many things, right? So sometimes it takes 40,
so it's like
minutes.
someone else can be filling it, but then the pharmacist is the guy who always has to, like, he's the main guy there.
Well,
or is there multiple pharmacists?
That's the thing. Usually most retailers will have one pharmacist, but this is kind of what we've changed, because pharmacists are done like, we have the knowledge. We should be the pill doctor, right? But most retail pharmacies, there's no money in that. They just want to push out. They don't want to reduce how many meds you're on. We want to reduce the dose and even take you off meds if you don't need them. Sometimes meds are only supposed to be taken for 30 days, like the specialist gave it. But then the family doctor doesn't know how to get you off it, so they just say, keep taking it, and you've been taking it for 20 years now, and you didn't need to take it. So we need to take you off those meds if you don't need it. We need to do that as well. But there's no incentive because we make less money in the profession of pharmacy. So that's why we are focusing on that. It's crazy. And that's why then the side effect of one drug is treated with another drug, right? And it just snowballs. But
and then you want to know what else they would do? They'd send me, oh yeah, it's a refill, but then they'd only send like some of the stuff. Yeah. And then I'm like, what? And then it's like, that's when Jess was telling me, no, I use Health Depot. Yeah. And that, so that's I think that's the innovation too, is that, you guys make sure that
We sync it all up to
Yeah.
make sure we do one delivery to you wherever you want, and we keep them on track. And our pharmacists, because really the laws are that, you know, machines can fill them, people can fill the script, and it can be checked by a registered tech. It doesn't even need to involve the pharmacist. So our pharmacists are pill doctors, and all we do is engage the patient and the doctor, making sure that your circle of care understands that you're on the right meds. We don't waste their time checking pills.
right.
We have registered techs doing that.
How does a
That makes
patient
sense.
find you? This is fascinating.
Yeah.
I'm interested in it. And
Yeah.
we've
Jackie's
some
ready to go.
We've got some time constraints, so I would love to know,
Yes.
how do I find you? How do
Yeah.
I contact you?
Yeah, we're at the very easy. We're online at thehealthdepot.ca.
Thehealthdepot.ca.
We're part of Green Shield Canada. Like I said, Green Shield now, and we have like phone 1-800 numbers as well. But it's best easy to go to the website, thehealthdepot.ca, and that's why, like, you know, I'm at the cannabis conference, is because in order for patients that have other meds to be adequately put on cannabis,
Right.
and be able to, you know, adjust their other doses, that has to come through pharmacies. So medical cannabis, there's a big gap right now.
Let me ask
because
you a
pharmacy's
question
not
about
allowed
that.
to do
Let me
anything
ask you a
with it.
question about that, because is that the reason why some doctors are scared to prescribe cannabis, because maybe they understand the tweaking that would be involved and they just don't have the time for it? So maybe if there's, you know, they know about the Health Depot, would a doctor actually say, listen, fine, I will prescribe you this, but you need to work with someone like the Health Depot?
That is the ideal. I think that's the future of what it has to be. Doctors don't go to school and they don't learn the drugs to that extent. They don't know how much the drugs have to be adjusted. It's scary.
Right.
It's like
So
as
they're
a
just like,
pharmacist-
hey, well,
yeah, no, it's like, don't take that. I know what's going on here.
Right.
And they say, don't take cannabis because it's dangerous for you.
right, and it's
Don't
more
go near
work
it.
for them, and they
Exactly.
don't want the liability of it. They're just like, you want to know what? It's
Yes.
easier for me to just pawn it off over here. So that's sad, because it's not the best for that patient.
No.
You know,
that's
and
the
so
thing.
that's why it's like, you know, if they could say, hey, fine, I will prescribe you this, but I know you're on these other drugs, so you need to work with the Health Depot.
Yes.
And then I feel comfortable.
Yes,
That would
that's-
destigmify it and
Yes.
allow access to more
Totally.
cannabis patients.
Absolutely. But we also need to see a given dose,
Mhm.
because we don't know how much to adjust your meds unless we see an actual standardized dose of what you're taking, because you could be taking double, way more,
Right.
and that can affect your drugs even more, right? So that's why the eventual for health benefits and whatnot, it has to be standardized, has to go through pharmacy, and has to be done through prescription.
Right.
And there actually probably should be, because I think 60 to 70% of medical cannabis users right now go through retail, where they have no knowledge of this and it's causing effects and whatnot. Mostly they're probably not taking other meds because then they wouldn't want to take it. But if there's no optics of what you're taking and the effects it has on your other meds, you almost need to
Yeah.
have a black box warning that, you know, if you're on other drugs, you should talk to your pharmacist, right?
Yes.
So, yeah.
It should have a black box warning. We should.
And you explain it very well, because I didn't realize that, but I get it now. So it slows down
Your liver.
your liver, which then is affecting everything else.
All
that
your
you're
other
consuming.
drugs are sticking around a lot longer. Yeah.
Mm.
Not all, a lot of most of them. Yeah.
We'll have to have you back on the show,
Yeah.
Andy. You're a very intelligent, fascinating guy with a lot to tell us, a lot to share. It's really cool. I can't wait to reach out to the healthdepot.ca.
Yeah, thanks.
So
Yeah.
thank you for joining us in the Green Room live here at the Cannabis Wiki Conference and Expo in London, Ontario. Thanks again, Andy Donald.
It was a pleasure. Thanks again.
Peace.
Peace.
We're always fresh and a little bit sticky. The Green Room on Cannabis Wiki.